Hi, is your heart doing well or is there a little problem? Today I'm going to talk about the 5 signs that appear on your body that may indicate that your heart isn't at 100%. We know that cardiovascular disease is the #1 cause of death in the world. The heart kills about 20 million people per year. So stay alert. I'll divide this video into 3 parts. The first part is about the 5 signs. Those you can see that something is wrong. What you should pay attention to when looking for heart problems. In the second part, I'll talk about the 5 classic symptoms. What you feel when your heart isn't doing well. Are you or any family member experiencing this? And in the end, I'll give you valuable tips to avoid a heart problem in the future. It will be a very comprehensive video, so stick around until the end, and I'm sure there's a lot you've never heard before. But before that, start enjoying the video, because the more people like the video, the more YouTube distributes it to people who don't have access to doctors or hospitals, and also share the video with your friends and family. Many lives can be saved with your help. So share it, and tell me, do you have a heart problem, or do you think you do? Where in Brazil or in the world are you from? Write down below. Let's go. What are the 5 signs you should watch out for that may be showing you have a heart problem? What are the signs you can see? 5th sign, hair loss on the legs. Hair loss, first on the shins and then on the thighs, can be a sign that you have peripheral arterial disease. That is, blockage in the arteries of the legs. And since atherosclerosis is not a localized disease but diffuse, if you have a blockage in the arteries of the legs, you may have blockages in other arteries of the body, including the coronaries, which supply your heart. Most people with peripheral arterial disease only realize that something is wrong when atherosclerosis is advanced. And why do they lose hair? Because hair follicles need nutrients for hair growth, so they need good circulation. If your arteries are clogged with plaque, blood and oxygen won't reach them adequately. In addition to losing hair on the legs, the person may have smoother and shinier skin, cold skin, decreased nail growth. But let me emphasize that hair loss on the legs can also happen for other reasons, not just because of peripheral arterial disease. Genetics can also cause hair loss from rubbing against pants. 4th sign, xanthelasma. You may have looked at someone's eyes and noticed a yellowish plaque on the eyelid. So that's called xanthelasma. It doesn't hurt, it's usually just an aesthetic problem that grows slowly. Xanthelasmas are the most common type of xanthoma, which are cholesterol deposits in the skin. It is more common in middle-aged women and is mainly located on the inner corner of the eye, most often on the upper eyelid. About 50% of patients who develop xanthelasma have dyslipidemia, high cholesterol or high triglycerides. And see what's interesting? Only 1% of people with high cholesterol have xanthelasmas. But researchers have found that having xanthelasmas increases the risk of heart disease, heart attack, and stroke. So if you have xanthelasma, you should get a blood test to check your cholesterol and triglyceride levels to make sure they're not high. 3rd sign, cyanosis. Cyanosis is that bluish or purplish coloration on the skin. Could it be that it's very cold and it's turning purple? It could be, but it could also be saying that you have a heart or lung problem. If an area of your skin is cyanotic, bluish or purplish when you're warm, it may be a sign that that part of your body isn't getting enough oxygenated blood, which is red. An artery may be blocked. Now, if the person is complaining of shortness of breath, it could be a lung problem, pneumonia, emphysema, pulmonary embolism, or heart failure when the heart can't pump enough oxygenated blood. Of course, here too, other causes such as congenital defects like tetralogy of Fallot, which causes cyanosis, fit in. 2nd sign, ulcers. Those wounds that don't heal on the legs or feet may indicate poor circulation. It may be due to arterial insufficiency from some obstruction in the artery that supplies that area. And usually the person won't be able to walk much or fast because their legs get tired and painful, or they may even have cramps. Most of the time, these ulcers are painful. But if you have nerve involvement, like diabetic neuropathy, you may not feel pain. And arterial ulcers usually appear on the outside of the leg and heels, on the toes, and usually don't bleed. The other ulcers are venous, which are the most common and are related to varicose veins or venous thrombosis. Unlike arterial ulcers, they affect the inside of the leg and usually bleed. 1st sign, swelling in the legs, ankles, and feet. This swelling or edema in the legs and ankles can be caused by a weak or enlarged heart that can cause fluid buildup in the body. You may feel that your shoes don't fit anymore, a tighter sneaker. The ankle becomes puffy, looking like that bread that's baking. When you press it, makes that dimple, what we call a pitting edema. You're more likely to notice this swelling in your legs and ankles at the end of the day because gravity increases the pressure in the leg veins. And if you lie down and elevate your legs, it also reduces swelling. And what are the 5 symptoms that you're feeling that you may have some problem in your heart? The first symptom you should watch out for is shortness of breath or dyspnea. especially when you exert yourself. It's in disproportionate tiredness to the efforts. You get more breathless with everything you do. It could be a heart problem. Second symptom, persistent cough with white or pink phlegm, meaning there's fluid in your lungs, in your alveoli. It's important not to ignore this cough. See a doctor? Third symptom, shortness of breath when lying down. The person starts putting more pillows to see if they sleep better and over time can't lie down, have to sleep in a chair. You can also wake up breathless at night, what we call paroxysmal nocturnal dyspnea. This speaks a lot in favor of a heart problem. Fourth symptom, generalized weakness. Feeling tired all the time and difficulty in daily activities, such as shopping, climbing stairs, carrying groceries, or walking. This is because the heart can't pump enough blood to meet the needs of the muscles and tissues of the body. Fifth symptom, nocturia. When you wake up, you have to wake up many times at night to pee. This is called nocturia. There are several causes, but if the heart isn't pumping properly at night, this excess fluid needs to be eliminated. If you have these symptoms, you should see a doctor as soon as possible. And now, how to prevent it. How to avoid having a heart problem. 1. Exercise. Get out of the chair. Don't stay still. Physical activity is extremely important for your circulation, for your heart, for your mental well-being. Low-impact exercises like walking, cycling, swimming can even improve flow caused by chronic obstructions in the veins and arteries. 2. If you smoke, quit smoking. Smoking is one of the worst things you can do for your health. Smoking causes impotence, inflames all your arteries, and forms fat plaques, increasing the chance of heart attack, stroke, and dementia. 3. If you're overweight or obese, lose weight. Excess weight increases your blood pressure, worsens blood sugar, inflammation, overloads the heart, kidneys, joints, and the venous system, increasing the risk of thrombosis. It also increases fat in the liver. 4. Eat healthy. Lots of fruits and vegetables, fiber, whole grains, olive oil, and little red meat and processed foods. 5. If you have a family history, especially a father, mother, or siblings who have a heart problem, heart attack, stroke, stent, heart surgery, you should be more attentive than other people. If many people in your family suffer from heart problems, you need to have more in-depth exams. 6. Take care of your cholesterol and triglycerides. Eat more oats, cut trans fats and saturated fats. Lose weight. Eat more fiber, exercise. And even doing everything right if you can't reduce it. Don't be upset if your doctor prescribed medication. 80% of cholesterol is manufactured by the liver. Even doing everything right, sometimes it's not enough. 7. Keep your glucose under control. If you're diabetic or pre-diabetic, controlling your blood sugar levels well reduces complications. HbA1c should be below 7. 8. And lastly, control your blood pressure. Your goal is to keep your blood pressure below 120/80. For some, the goal may be less aggressive, like not being higher than 140/90. And of course, if you think you have a heart problem, if you've seen several signs and have some of those symptoms I just mentioned, see a doctor, explain to him, and follow his instructions. Did you like the video? Remember to share it so more people have this knowledge. And please don't forget to give a like and subscribe to our channel. If you've ever had any of these signs and indeed had a heart problem, please share your experiences in the comments. And what will be the next video you'll watch? I'll leave 2 recommendations here on the side. Stay healthy, stay happy!